You'd have to be barking mad to miss this sketch. Our four-legged friends need stimulation and exercise too, so in this lesson we'll be covering psychostimulants, specifically amphetamine, dexamphetamine, lisdexamfetamine, and methylphenidate. Hold on, because this one is high energy. Psychostimulants are indicated for a variety of different conditions, primarily attention deficit hyperactivity disorder, or ADHD, symbolized by our dog walker's AD/HD band shirt. Rock on, man. Someone control that binging dog? There's really nothing left for the rest of us. Speaking of binging, some psychostimulants, like lisdexamfetamine, are also indicated for moderate to severe binge eating disorders.
Aw, a little sleepy narcoleptic pig. How cute. And with little methyl CH3 collar.
Well, let this remind you that methylphenidate is also indicated for narcolepsy.
He's baking me tired, too. Bacon jokes.
Psychostimulants are sympathomimetics. They exert their behavioral effects by enhancing the neurotransmission of monoamines in the brain, particularly dopamine and norepinephrine, also called noradrenaline in some countries. At Sketchy, we symbolize dopamine by ropes, in this case rope leashes for the puppers, and norepinephrine, often abbreviated to NE, as a compass pointing to northeast. And chaos ensues. These dogs have been released and are taking those dopamine ropes with them. Those dopa-rope-released dogs escaping from the park will help you recall that amphetamines are releasers of monoamines, like dopamine, from presynaptic neurons. Hopefully, these chaotic dogs don't dive into that messy-looking tar pit. How agonizing that would be. Well, amphetamine is a full agonist of TAR1, or trace amine-associated receptor 1. TAR1 is a GS-coupled and GQ-coupled G-protein-coupled receptor that has an important role in the regulation of brain monoamines. Amphetamines, symbolized by our best friend of mine, pup, also inhibit vesicular monoamine transporter 2, or VMAT2. Those pups are doing a good job of inhibiting V-neck-wearing Matt from packing away those dopamine ropes. The role of VMAT2 is for the transport of monoamines into presynaptic neuron vesicles. By inhibiting VMAT2, the concentration of monoamines in the systole of the neuron increases. It's just chaos in here. Let those spinning turnstiles represent monoamine transporters, spinning in reverse as those dogs escape. Amphetamines reverse these monoamine transporters like DAT and NAT, causing the release of dopamine and noradrenaline into the synapse. Finally, amphetamines competitively inhibit DAT and NAT, competing with dopamine and norepinephrine, respectively, meaning synapse concentrations of these monoamines will increase as uptake into the presynaptic neuron is inhibited. Just like our narcoleptic methyl-collared little pig blocking the transporter turnstiles, methylphenidate is also a blocker. It works by blocking the dopamine transporter and norepinephrine transporter, causing dopamine and norepinephrine to build up in the synapse, resulting in increased alertness. Lisdexamfetamine is produced as an inactive prodrug that is converted to dexamphetamine, the active form, and L-lysine by enzymatic hydrolysis in the blood. Let this product list remind you of this prodrug, lisdexamfetamine. This characteristic prolongs the duration of action of the stimulant, providing a long-term efficacy throughout the day with once-daily dosing. And how better to symbolize that than a cute, long dog proudly carrying that product list? She's not only long, but a little low to the ground, too. Well, lisdexamfetamine also has lower risk of abuse or diversion, partly due to dampened euphoric and drug-liking effects compared to amphetamine and dexamphetamine. Psychostimulants are contraindicated with concomitant use of MAO inhibitors, or within 14 days of stopping a MAO inhibitor. And it's been 14 days since that pesky mouse has been seen. So let that sign, "We've been mouse-free for 14 days," remind you of this important point. Why is this so essential? Well, Combined use may result in sympathetic overactivity, leading to increased blood pressure, rapid heartbeat, seizures, or hallucinations, like how some people may feel when they see a mouse. Psychostimulants have a high potential for abuse and dependence, and are scheduled alongside other drugs of abuse and dependence in many jurisdictions, including the United States, Australia, the UK, and the EU. Prior to starting therapy, an individual should be assessed for risk of abuse and dependence, and one should be monitored for signs and symptoms of abuse. Long-term abuse can cause dependence and tolerance with varying degrees of irregular behavior. That PSA to prevent dog abuse drives this point home. In addition, parents, carers, siblings, and friends should also be monitored for signs of possible diversion. There are a number of contraindications and precautions to keep in mind when providing psychostimulants. Psychostimulants are contraindicated in people with hyperthyroidism or pheochromocytoma due to the risk of sympathetic overactivation. We symbolize hyperthyroidism with this snazzy red bow tie and pheochromocytoma with this frozen chromatic shaved ice. Cool brain hat! Psychostimulants may worsen or cause new-onset psychosis and mania in patients. Use caution in patients with pre-existing psychiatric conditions like bipolar disorder, as it may exacerbate the condition. Psychostimulants should be used with caution or avoided in patients with a history of angina, arrhythmia, hypertension, congenital heart disease, cardiomyopathy, or ischemic heart disease, as these conditions may worsen with use. That heart patch should keep these precautions top of mind. That's funny, considering that brain hat, right? Oh, buddy. Looking a little overstimulated and wide awake. Psychostimulants may cause insomnia, which is marked by not being able to fall asleep, stay asleep, or frequently waking up early. That guy is going to crash hard when those stimulants wear off. He's not only overstimulated, but also underweight, looking a little thin. Psychostimulants may cause weight loss and decreased appetite in patients. This is also why amphetamines are indicated for the treatment of exogenous obesity or binge eating. And just to top off an already interesting day for our friend here, he's looking a little nauseated and headachy with that tight headband on. That will help you recall that psychostimulants may cause headaches and nausea as well as dry mouth. We didn't ask him to open up. He's going through enough as it is. What? A dog park that closes at noon? This is only for early morning risers, it seems. Patients should be advised to avoid taking psychostimulants in the early afternoon or evening, as they may interrupt sleep or cause insomnia. Early morning dosing is desirable to allow the medication's effects to wane before bedtime. And finally, before initiating treatment with psychostimulants, an assessment of cardiovascular function should be conducted, along with weight and height. These should be monitored regularly during treatment. The local sketchy vet has come along to offer some health assessment for our active, stimulated pups. I can see some scales for weight, a tape measure for length/height measurement, and an EKG machine to assess heart function. On second thought, I'm glad this park closes at noon. Imagine being here all day. You'd end up like our poorly slept, overstimulated friend over here. Psychostimulants are popular treatments for ADHD as well as narcolepsy and weight management, but do come with a risk of abuse, dependence, and diversion. Remember to be astute and pick up signs that things may be going awry with patients using these treatments, as early intervention is always best when dependence or abuse issues may be developing. Check out our other sketches in the neurology and psychiatry course. Plenty more to see, and just as stimulating, I promise.